Brains Hospital is creating an awareness program during the month of March to prevent head injuries. Head injury is a menace that exclusively affects the young, productive age group of our country. The 15 to 35 years of age group is being affected. Significant number of people are getting head injuries, leading to tremendous amount of disability as well as death. It is surprising that even during the lockdown periods and the COVID times, the death rate has never come down. Probably the number of accidents have come down, but the death rate remained high. This exactly shows there is some serious problem with us and with our culture, with our driving habits, with our roads, the licensing system, and probably the vehicles, and the whole system should be blamed for this, that the death rate continues to be high regardless of whatever is the situation around us. The important thing to note is that head injury itself is preventable. Secondly, when there is a head injury, the death and disability is also preventable, provided we all know how to deal with that right from the scene of the accident within the golden hour. The first hour after the accident is called golden hour, and treatment should happen within that time. So right from the beginning, what we call and taught is the ABC, is the airway, breathing and circulation. If these three fundamentals are ABCs, the person is not breathing well, his airway is not blocked, or if circulation is not good, then he is under the threat of life, and that individual need to be shifted with all possible assistance as quickly as possible to the nearest hospital. Now, one of the ways is to ensure his safe transportation, and his breathing is compromised, circulation is compromised, probably his BP is dropping, and the brain is not getting adequate oxygen and blood supply. You can't dump them in an auto or somewhere unassisted and bring them to the hospital. We are doing more harm, and during the transportation there will be a permanent brain damage, and after that whatever advanced treatment we do on them, still it will be effortless, and the results will not be very good. You have to have better outcomes of these people. By only way is that bringing all the accident victims, particularly when there is life risk, in the right time, that is the golden hour, to the right place where they can be adequately and appropriately treated by the right method, that is providing the oxygen, maintaining the airway, protecting the neck, protecting the spine, and preventing the bleeding during transportation, and continuing the first aid, and by the right people who knows how to deal with this. So please call for an ambulance and make sure that the person is assisted and transported safely to the nearest hospital. You can only help him by getting an ambulance and assisting the ambulance crew to the transportation. You can be part of this life-saving mission, and you will certainly save many lives by doing that. It is also important that you know the basics of the first aid, at least to identify the compromised airway, breathing and circulation in an individual, so that we can identify on the roadside after an accident who are at life risk.